Senator King, thanks for that summary, and recognize now Senator Duckworth.
Thank you, Mr. Chairman, and thank you to all the witnesses who are here today. As you know, Mr. Chairman, this committee has earned a longstanding reputation for prioritizing pragmatic bipartisanship. In my view, it is a commitment that all committees should strive to achieve. Preserving the bipartisan nature of our work is especially critical amid this administration's attacks on America's cities, and while Immigration and Customs Enforcement is actively stealing U.S. Department of Defense and U.S. Department of Veterans Affairs resources away from their core mission to support its invasion of Chicago. Specifically, at Hines VA Hospital, my VA home, where I get my care, it already suffers from limited parking that is inadequate for the level of patient demand. I think any veteran that goes to a VA hospital shares a frustration across the country of the inadequate parking. ICE has taken over 12 parking spots for operations at Hines VA that have nothing to do with providing veterans with care, and this is causing anxiety and confusion among staff and patients. Diverting VA resources for ICE's reckless paramilitary immigration enforcement operations not only does nothing to enhance veteran care, but it likely will harm care delivery. Veterans should be able to safely access their health care services without fear of intimidation, harassment, or even detainment. And it is absurd to believe that allowing ICE to operate in any capacity on any VA campus will not adversely impact delivery of care for their patients. This is especially true at Hines. The VA must establish a clear, strong policy against capitulation to ICE. Veterans and their family members that receive care at VA medical facilities across the country need to be protected. Otherwise, I am deeply concerned that patients would delay or cancel their appointments due to well-documented risk that they will be aggressively accosted by an out-of-control, secretive paramilitary force and whisked away in unmarked vans solely because of the color of their skin, what they look like, race, or the language that they speak. If VA fails to stop ICE's theft of its resources, the department will validate the veteran community's worst suspicions about the Trump administration, namely that President Trump is sabotaging VA's ability to carry out its mission and actively working to manufacture a crisis that would justify privatization of the VA. Earlier this year, VA cut 80,000 jobs, including doctors and nurses. A recent ProPublica article reported on the consequences of this massive disruption, noting, and I quote, "The VA this year is down more than 600 doctors and about 1,900 nurses. The number of doctors on staff has declined each month since President Donald Trump took office. The agency also lost twice as many nurses as it hired between January and June." The VA said it is working to address this, including by referring veterans to private providers and telehealth appointments. Meanwhile, waiting times for new patients seeking primary and specialized care are increasing. And I'm gravely concerned that Trump administration's dismantling of VA's capabilities and capacity is intended to create chaos that will achieve two of their main goals. First, they want to accelerate VA dependence on private sector providers. And second, they want to degrade VA's quality of care to justify privatizing our nation's largest integrated healthcare system. Dating back to President Trump's first term, we know he is surrounded by wealthy donors who would love nothing more than to dismantle VA and force all veterans, particularly veterans who need specialized care, into the often more expensive yet less effective private sector healthcare system. After all, VA providers are trained so they can address the unique needs of veterans, and this is just not true for most non-VA providers. A non-VA provider may look at a veteran and see that they have prostate cancer, but not check them for ischemic heart disease or leukemia B, two other conditions that are tied to Agent Orange exposure, for example. Instead of siphoning resources away from the VA to a civilian health system that is already under duress due to Republicans' biggest Medicaid cut in history, we should be investing in VA civil servants while upgrading facilities and technologies to strengthen VA delivery of care. To all of the panelists, what specific steps should the VA take to ensure there are enough providers and accessible facilities for treating veterans with SCI D in a timely manner and with the dignity and respect that they deserve? Would anybody of you like to answer that? Do you have any steps that you think the VA should be taking to support spinal cord injury patients, also through the providing providers as well as access to facilities?
Shelley and I mentioned in our testimonies, stop any hiring freezes or hiring caps, support and fund additional positions. Those, I think, are going to be the biggest steps you can make. it's hard to serve our veterans with their hands tied behind their backs right now, and it feels like that's what a lot of them are doing.
Thank you. Thank you, Mr. Chairman.